noticed a feeling of pressure or heaviness or even a bulge down below, it can feel concerning, but you're not alone. Prolapse is incredibly common after pregnancy, and the good news is there are things that we can do about it. So I'm Brooke, I'm an obstetrics and gynecology doctor, and in today's video we're going to be talking something that many people go through but rarely talk about: vaginal and uterine prolapse. So I'm going to explain exactly what prolapse is, the different types of prolapse, how it's diagnosed, what treatment options there are available, all based on the latest NICE guidance in the UK. What actually is prolapse and what does it look like? If you ever looked down at your vagina in the weeks after you've given birth and noticed a bit of laxity or a bulge there, or even felt a lump like you're sitting on an orange, you could have a prolapse. Pelvic organ prolapse happens when the muscles, the ligaments, and the connective tissues that are all supporting your pelvic organs, like your uterus, your bladder, and your bowel, become weakened or stretched out. So this can happen during pregnancy, especially if you've had a vaginal delivery, or it can also happen later in life after the hormonal changes and the effects of aging. So when these support structures are compromised, the organs can shift out of the normal position and then bulge into or even out of the vagina. Think of your pelvic floor like a hammock or a sling that holds everything inside where it should be. And if it gets overstretched, those organs that it's supporting can start to drop down. This can then lead to symptoms like dragging or a heavy feeling in your pelvis, or a bulge that you can actually see and feel, or you can get some backache or difficulty fully emptying your bladder or your bowels. And some people also experience discomfort with sex. So what type of prolapse are there? Well, there's lots of different types of pelvic organ prolapse. It depends on which organ is moving into the wrong place. So a cystocele is when the bladder bulges into the front wall of the vagina. Rectocele is when the rectum pushes into the vagina. Uterine prolapse is actually when the top part of the cervix or the uterus drops down into the vaginal canal lower. A vault prolapse happens in women who've had a hysterectomy, when the top of the vagina starts to lose its support. An enterocele means that you've got a part of the small bowel pushing up into the upper back wall of the vagina. Some people have more than one type of prolapse at the same time. You can have the front wall and the back wall bulging into the vagina. So how common is it? Well, up to half of women who've had a vaginal birth will experience some degree of prolapse in their lifetime. Now, anyone can get a prolapse, especially anyone who has been pregnant at any point, but many of the studies, such as this one, do suggest that there is a higher risk of getting a prolapse if you had a vaginal birth than a C-section. Now, ultimately, the good news is it's not just something that you've got to put up with for the rest of your life. There is treatment available. So, firstly, how do we diagnose prolapse? Well, if you think you might have a prolapse, then the first step is to speak to your doctor, speak to your GP or a gynecologist. Diagnosis is usually made with a simple vaginal examination. So your doctor might ask you to bear down or to cough while they're examining you to see how much the organs move and which organ is moving into which area. Now, in most cases, that's enough to confirm the diagnosis and plan the treatment, but sometimes we might need to have some extra imaging, either with an ultrasound scan or an MRI. Well, the good news, as I've already said, is there are options, and not all prolapse needs surgery. According to the latest NICE guidelines, the first line of treatment should actually be to start with the least invasive option. Step one is lifestyle changes. That means if you are overweight, then we recommend losing even a small amount of weight can make a big difference to your prolapse. It relieves the pressure on your pelvic floor. We also recommend managing constipation. You don't want to push down too hard. We recommend avoiding heavy lifting and also switching to pelvic floor friendly exercises to help to reduce the symptoms you might be experiencing. Some people that's enough, but we also can offer vaginal estrogen if you're breastfeeding or if you've been through the menopause. Low estrogen levels in the vagina can worsen the feeling of prolapse, the sensation, and the chance of getting recurrent infections. So using a low dose of vaginal estrogen cream or pessary can actually improve or even relieve the sensation of having a prolapse. So step two is pelvic floor physiotherapy. This is often the most effective next step. So you work with a specialist women's health physiotherapy who can help you to retrain and strengthen your pelvic floor muscles. NICE actually recommends that you do at least 16 weeks of supervised training to see improvement. It's safe to start soon after birth, but it's really a good idea to complete that longer course. You might not recognise results immediately. Now, step three is the option of vaginal pessaries. So these are small silicone devices that are inserted into the vagina that help to support the organs and to relieve that dragging or that bulging sensation. Now, there's lots of different types and different sizes, and they can be an excellent option if you're not ready for surgery or if you're still planning to have more children, so you don't have that definitive treatment just yet. Your doctor or nurse can help you to find the right pessary for you and show you how to care for it. Vaginal estrogen can also be used to help people who have a pessary to stay in place for longer or stay in place more comfortably. Finally, surgery. So surgery is an option if your symptoms don't improve or they're significantly affecting your quality of life. So, depending on the type of prolapse that you have, this could include anterior and posterior vaginal wall repair, so vaginal surgery, uterine suspension procedures, particularly if you've got a uterine prolapse. Some people have either a Manchester repair or a hysterectomy, so removal of the womb permanently, which again can often be done via a vaginal approach. The NHS actually has a really good decision aid to help you and your doctor decide the best surgery for you if you have got a uterine prolapse, because there are lots of different options, and there has been some recent controversies about the surgical management of prolapse because of the use of mesh. So I don't want to go into too much in this video, but mesh was something that's been used to support vaginal prolapse repairs. It can still be used in certain situations, but it's not right for everybody, and it has got risks to be aware of. So if you do need some surgery for a uterine prolapse, you can look at this decision aid with your doctor to help you to make the right decision for you. So the surgery for prolapse can be done vaginally, laparoscopically, so through small cuts in the tummy, or even using a robot, depending on the issue and what type of surgery you're having. So which surgery you could choose is definitely too much to cover in this video, but let me know if part 2 would be helpful. Now, what if you have had a baby? Well, if you are recently postpartum, it's important to know that some degree of prolapse can improve over time. So the first 3 months after you give birth are a time of lots of changes in your body and lots of recovery as well. And during this time, doing your gentle pelvic floor exercises can help that recovery process of your pelvic floor. But if something still doesn't feel right, you don't have to wait all the way up until your 6-week check to speak up. And then if you're still concerned that you have a prolapse, you should discuss it with your doctor, probably around the 3 to 6 month mark after giving birth. So prolapse is incredibly common, but it's still surrounded by so much silence and shame, and it shouldn't be. Your symptoms are valid, they can have a big impact on your quality of life, and you do not have to put up with them forever. So whether you're newly postpartum or you're several years on, there are effective treatments. If this video helped you, please give it a like and share it with someone else who might also benefit from understanding this information. And if you've had your own experience with prolapse, please share below anything that might have helped you. Your story might just help someone else feel less alone. Thank you.